ADHD, like many other developmental disorders, is in fact on the rise. ADHD is one of the most common developmental disorders in children, and the Centers for Disease Control would estimate that it should affect approximately 7% of children in America. However, at any given time, only 3 to 5% of children in America are receiving treatment for ADHD. So despite the increase in its prevalence, it's actually being underdiagnosed. ADHD is a learning disorder, and it can also have learning disabilities associated with it. There are different aspects to attention deficit hyperactivity disorder, and that's why there is a slash between the D and the H in ADHD. That means that the hyperactivity is actually optional. So you could have a child who is hyperactive and impulsive, or a child who is just inattentive. ADHD is diagnosed by using psychological testing and behavior rating scales collected at home and school, and if the child is 11 years of age or older, the child also can complete rating scales. The psychological testing includes measures of intelligence, executive functions, and computerized measures of attention and impulse control. A learning disability is diagnosed also using the same instruments as an ADHD evaluation, but is actually more comprehensive. It also includes measures of the child's achievement as well as learning style. Treatment for ADHD and learning disabilities includes family education to help them understand the nature of their child's struggles in school, at home, and with friends. It also includes consultation to school to help the child become more effective in their school performance. It can include group therapy for children who have social skills deficits. It can also include accommodations at school and on standardized testing. For some children, medication may be an option. ADHD and learning disabilities are basically information processing disorders. It affects the input, the process, and the output stage of learning. The input stage is being ready to learn and paying attention. The process stage is being able to store and organize information for later retrieval. And the output stage is when people display what they have learned, either verbally or behaviorally or through written language. These skills become more important in adolescence and adult life because of the importance of information processing in the workplace. Therefore, ADHD and learning disabilities continue to affect the individual in the world of work and in their interpersonal relationships.